At my direction, the federal government is working to help obtain large quantities of chloroquine. And you can look from any standpoint tomorrow in New York. We think tomorrow pretty early, the hydroxychloroquine and the Z-Pak, I think is a combination, probably is looking very, very good.
This is a little bit like testing new tires on a moving car. Tomorrow, clinical trials will begin in New York for a malaria medication dispensed in combination with an antibiotic to treat coronavirus. As we mentioned, Dr. Anthony Fauci notably absent from today's coronavirus briefing at the White House. But on Friday, he was asked about the efficacy of repurposing this old malaria drug for this illness.
Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence.
So there's that. And with us tonight by phone, which we sure tried to get her, be able to see her on Skype, Laurie Garrett. As a science writer, she is the recipient of the Pulitzer Prize, the Polk and Peabody Awards. She's the author of The Coming Plague and Ebola, Story of an Outbreak, a rom-com, obviously. She's also a contributor to Foreign Policy and a former senior fellow for global health over at the Council on Foreign Relations. Laurie, thank you very much for coming on and putting up with a blanket electronic failure into and out of our 30 Rock control room tonight. Talk some more, please, about this medicine and any danger as you see it from a public health perspective of getting hopes up high in any of these areas.
Well, as you know, Brian, there is a woman fighting for her life in a hospital in Arizona tonight. Her husband died because they took chloroquine after hearing the president say it was the right way to treat their COVID-19 illness. And it turned out they took chloroquine phosphate, which is used to clean out fish tanks. It killed one of them, and the other is fighting for her life. This is the danger of saying things and announcing treatments, announcing medicines when they haven't been proven, when there are people in the public who won't fully understand the nuances. They're not doctors. They don't know how to dose themselves properly. They'll go out and they'll buy fish tank cleaner, thinking that that's the anti-malarial drug chloroquine. I think that this is just heading down a path towards devastating outcomes as we have the president announcing medical breakthroughs, supposedly, and we have certain commentators beating the drum in favor of these medicines, but they've not been proven. They've not been subjected to clinical trials. And these are not drugs without side effects. I mean, one of the drugs in the pack is AZT. That was the very first drug invented for treating HIV illness. And that drug had a whole range of side effects.
Can you believe that in the greatest country on earth, we had tested by the end of February, this came out today, 352 individuals. So roughly the number of passengers who can fit on the largest passenger jet in the world. The greatest country on earth had tested a sum total of 352 souls in the month of February. What does that tell you?
Well, it tells me that we weren't taking this seriously. We weren't acting when acting could have made a difference. And we weren't doing the things we needed to be doing to bring this epidemic under control. Look, Brian, the latest data from the World Health Organization is really ought to be startling and terrifying to everybody because we're almost at 400,000 cases in the world. These are officially confirmed cases. And as Dr. Tedros told us today in his briefing, it took 67 days for the world to get the first 100,000 cases. It took 11 days to get the second 100,000 cases. It took 4 days to get the third 100,000 cases. And we may hit the 400,000 in just 2 days. This thing is taking off. It's skyrocketing. It's in nearly every country in the world. And it is out of control. So for us to be so far down the path, grasping at anti-malarial drugs, grasping at AZT, the ancient, 1980s version of HIV treatment, and telling the public that, hey, the stock market is the problem, we're going to take out all this social distancing nonsense within 15 days and you can all go back to work. This is just mind-boggling. Absolutely mind-boggling.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.